wonder what your child will look like. Will they have your personality, your smile, your eyes, or will they even look like you at all? At least once in our lifetime, we all think about having a child in the future. With most pregnancies being unplanned, a lot of decisions come to head. Will you be able to take care of that unborn child properly? Will you be able to give it the time that it needs, or are you just not ready for that child at this point in your life? There's two decisions a woman makes. One, they either give birth, or two, they get the child aborted. Arguments on abortion are as the following, according to Women's Issues, 10 Abortion Arguments by Linda Flowen, 2015. It's the woman's right, rape, they can't afford it, or the baby hasn't been born yet, so technically it's not living. Under different circumstances for each individual, I'm sure saying no to abortion is easier said than done. Just as mentioned previously, rape victims would likely choose abortion over keeping their child due to obvious reasons. I'm here to help you understand why giving birth to your child is the best way to go. A study was done on 31 women who had become pregnant due to rape. According to Life Matters, Pregnancy from Rape by Sandra McCorn, 2013, 28 continued their pregnancy, 5 chose abortion, and 4 were lost to follow-up. Fear, anger, and negativity were the main feelings towards becoming pregnant, and understandably so. But throughout the pregnancy, the women became more content, they had less anxiety, and they had more positive feelings. A small amount of these women chose adoption, while the majority chose to raise their child. Out of 28 women, none regretted giving birth to their child. Another study of 164 women who had chosen abortion, the majority highly regretted that decision. Therefore, having an abortion doesn't help resolve that problem or issue. In fact, it makes it worse. Having an abortion can cause medical complications such as ectopic pregnancies, double, miscarriages, and pelvic inflammatory diseases. These are just a few examples. The big fuss about abortion is whether that unborn child is actually living or not. If something's not living, obviously it can't feel anything. Biology proves that once conception happens, an organism is in existence. Since this new life possesses human DNA and is the offspring of human parents, it can legitimately only be described as a human life, according to Pro-Life Action League 2015. With that being said, living things can obviously feel. According to Minnesota Citizens Concern for Life, unborn babies can feel pain 2014. With the advent of sonograms and live-action ultrasound images, nurses are able to see unborn babies at 20 weeks gestation react physically to outside stimuli such as sound, light, and touch. The sense of touch is so accurate that even a single human hair drawn across an unborn baby's palm causes the baby to make a fist. At 20 weeks, the fetal brain has the full complement of brain cells present in adulthood, ready and waiting to receive pain signals from the body, and their electrical activity can be recorded by standard EEG. That's from Dr. Paul Rinaldi, a neurologist at the University of Toronto. An unborn baby at 20 weeks gestation is fully capable of experiencing pain. Without question, abortion is a dreadfully painful experience for an infant subjected to such a surgical procedure. That is from Robert J. White, professor of neurosurgery. Unborn babies at 20 weeks development actually feel more pain than adults. This is a vulnerable time since the pain system is fully established, yet the higher level pain modifying system has barely begun to develop, according to Dr. Rinaldi. Having administered anesthesia for fetal surgery, I know that on occasion we need to administer anesthesia directly to the fetus because Even at these gestational ages, the fetus moves away from the pain of stimulation, stated David Bernbach, president of the Society of Obstetric Anesthesia. The unborn baby, the skeleton is complete and reflexes are present at 42 days. Electrical pain wave patterns can be recorded at 43 days, and this is evidence that the child's thinking is taking place in the brain. The fetus has the appearance of a miniature body with complete fingers, toes, and ears at 49 days. All organs are functioning, like the stomach, liver, kidney, brain, at 56 days. By 20 weeks, the unborn child has hair and working vocal cords, sucks her thumb, grasps her hands, and kicks. She measures at 12 inches. And here is a picture of a baby at 1 month all the way to 9 months. Despite the unborn child's advanced development at 20 weeks, the following painful abortion procedures are used. Partial birth abortion. The unborn baby is delivered feet first, except the head, which is punctured at the base of the skull with a sharp object. The brain is then suctioned out, killing the child. Dilation and evacuation. Sharp-edged instruments are used to grasp, twist, and tear the baby's body into pieces, which are then removed from the womb. Right here, I have images of that being done. They're grasping the baby by his arms, his legs, and taking it out of the womb. And this is the aftermath. Here's the baby's head. His arms unattached over here, but they actually left his legs on this one. Also, saline abortion. Salt water is injected into the womb through the mother's abdomen. The unborn baby swallows this fluid, is poisoned, and sometimes takes 24 hours. The toxic saline solution causes severe burns of the unborn child's entire body. Statistics show that 4 million babies were born in the U.S. in 2007. 1.2 million abortions happen each year in America. Abortions, the highest abortion age range is from 20 to 24 years old. According to Nurses Share Stories of Witnessing Babies Born Alive After Abortions by Sarah Terzel, April 15, 2013, states that she wasn't busy one day during work. She went into a nursery and saw a bassinet with a baby inside. She noticed the baby was scalded, but besides that, it was a perfectly formed baby. She was ashamed of her profession that night. She said, "It's hard to believe that this can happen in our modern hospitals, but it does." She asked another nurse at a hospital what they do with their babies that are aborted by saline. Unlike my hospital, where the baby was left alone struggling for breath, their hospital puts the infant into a bucket and puts the lid on, and that baby suffocates. A lot of psychological effects follow an abortion, according to American Pregnancy Association. Regret, anger, guilty feelings, shame, sense of loneliness or isolation, loss of self-confidence, insomnia or nightmares, relationship issues, suicidal thoughts and feelings, eating disorders, depression, and anxiety. Other options can be made instead of abortion, such as raising the child, temporary foster care, reach out to a family member for help, and adoption. With adoption, your pregnancy ends in giving a life, and abortion, it ends in death. Adoption, you can feel positive about your choice. You will remember giving birth. You'll have plenty of time to plan for you and your baby's future. You can hold, name, and love your baby, and you can continue contact with your baby. Whereas abortion, you may feel guilt and shame. You will remember taking a life, and it's final, and you cannot go back on that decision. You will never know or treasure your baby, and you will miss the opportunity to see your child develop.